Hello everyone, today we are going to talk about rabies. Rabies is a viral disease that can affect the nervous system of mammals, including humans. The disease is caused by the rabies virus, which belongs to the lyssavirus genus. Rabies is typically transmitted through the saliva of an infected animal, often through bites or scratches. The rabies virus primarily infects warm-blooded animals, and it is most commonly transmitted to humans through the bites of infected animals, especially domestic dogs. In some regions, wild animals like bats, raccoons, foxes, and skunks can also be carried of the virus. The virus enters the body through broken skins or mucous membranes and then travels to the nervous system, causing inflammations of the brain and spinal cord. The exact origin of the rabies virus and the first case in history are challenging to determine due to the ancient nature of the disease. Rabies has been present for thousands of years and it is mentioned in various historical texts. One of the earliest recorded accounts of rabies date back to ancient Mesopotamia around 2300 before century, where the symptoms of a disease resembling rabies were described in the Codex Aegina. Similarly, the ancient Greeks and Romans also documented cases of a disease with symptoms consistent with rabies. The term rabies itself comes from the Latin word rabies, meaning madness or rage, reflecting the characteristic aggressive behavior observed in animals and humans infected with the virus. Over time, our understanding of rabies has improved, and preventive measures such as vaccination have been developed. Today, rabies remains a serious public health concern in many parts of the world, particularly in areas where this virus is still prevalent in animal population. Immediate and appropriate medical treatment, including post-exposure prophylaxis, is crucial if someone is bitten or scratches by an animal suspected of carrying the virus.
Hi, my name is Fatin Faisha, and in this video presentation, I will be talking about the basic characteristic of rabies virus. Alright, firstly, the classification of rabies virus. Rabies virus belongs to the genus Lyssavirus and in the family of Rhabdoviridae. Next, the structure of rabies virus is roid or bullet-shaped, negative sense unsegmented, single-stranded RNA and enveloped RNA virus. It is composed of nucleic capsid containing the nucleic acid and outer envelope, a lipid containing bilayer covered with transmembrane glycoprotein spikes. The virus genome encodes 5 proteins associated with the ribonucleoprotein complex, which is nucleoprotein, phosphoprotein, matrix protein, glycoprotein, and polymerase. The pathogenesis and the tropism of rabies virus. For the tropism, the virus has a strong affinity for nerve cells, neurotropism, particularly neurons in the central nervous system. After entering the body, the virus travels along peripheral nerves to reach the central nervous system. While for the pathogenesis, rabies virus causes an acute viral encephalitis leading to the inflammation of the brain. The virus spreads through the central nervous system, causing characteristic symptoms such as hydrophobia, which is the fear of water, aerophobia, which is the fear of air, and neurological dysfunction. That's all from me.
Assalamualaikum, my name is Afan Faziha and I will present the transmission of rabies virus in the human body. So here on the slide, we have 3 ways of how the virus can enter the human body. So the first way is by direct contact from infected animals such as bite and scratches. So the most common infected animal is dogs, and the most common way people get the rabies virus is from being bitten by infected dogs. And the next way of how the virus can enter the human body is by exposure of infected saliva or bodily fluid to an open wound or scratch. That means even if you are not bitten by any dogs, you can still get the rabies virus if you have an open wound and you are exposed to any infected saliva or bodily fluid. Last one is inhalation of aerosol containing rabies virus. So this can be a case for lab workers if they are not handling the sample correctly and are not wearing PPE properly. Next, we move to the viral routes in human body. First, it starts with the viral entry to the human body, and then the virus will move to the spinal cord and then to the brain. So once it reaches the brain, the virus can cause brain dysfunction because of protein defects and affected amygdala and hippocampus. So this viral action can cause behavior manipulation such as hydrophobia. Next, from the brain, the virus then moves to the salivary gland to manipulate the gland to secrete excessive saliva. So this is called hypersalivation, and this is for better transmission of the virus. Depending on the location of the bite, the virus can take around 10 to 50 days to reach the brain. It is considered fatal once the virus reaches the spinal cord and the brain. But medical action can be taken before the virus reaches the brain to stop the viral replication and hopefully prevent death.
Assalamualaikum and hi. My name is Muhammad Ilham Nur Hakim bin Ramli. My metric number is 2022775425. Today, I am going to present my part which is rabies symptoms. So, as we know, rabies is a viral infection that affects the central nervous system. It is primarily transmitted through the saliva of infected animals, commonly through bites. Once clinical symptoms appear, rabies is unfortunately almost always fatal. So, the journey of rabies begins with an incubation period, a variable span usually lasting 1 to 3 months. Remarkably, during this time, there are no visible symptoms. It is a silent but a crucial phase in the progression of the infection. Next is the prodromal stage. As the virus starts to impact, the prodromal stage emerges with symptoms reminiscent of the flu. Individuals may experience fever, headache, discomfort, nausea, and vomiting. These initial signs set the stage for the more critical phases to follow. Acute neurological stage takes a dramatic turn. The acute neurological stage showcases distinct symptoms which is hydrophobia, a fear of water. Swallowing becomes challenging and even the thought of water triggers muscle spasms. Next is aerophobia, a fear of drafts of air or the wind. Then, neurological symptoms which is fever and muscle spasms. Lastly, respiratory system which is difficulty in breathing and respiratory arrest. The journey often ends in a coma that typically follows within a few days to weeks after the onset of symptoms, frequently due to respiratory failure. This underscores the urgency of seeking medical attention promptly. That's all from me. Thank you.
Assalamualaikum, my name is Efadianti. So I will continue the presentation with the treatment for rabies. Rabies is not just a health concern but a medical emergency requiring immediate attention to prevent the virus from progressing to a fatal stage. The emergency response to rabies exposure is known as post-exposure prophylaxis (PEP). The treatment is critical because it keeps the virus from entering the central nervous system, which will almost always result in death. Quick action is required, preferably within hours after exposure. Now, let's explore the 3 key treatments for rabies. First, human rabies immunoglobulin, HRIG. For those not previously vaccinated, PEP includes HRIG and the rabies vaccine. HRIG provides antibodies to combat the virus near the wound until the body takes over. If vaccinated before exposure, HRIG is not recommended. Next is rabies vaccine, administered in 4 or 5 doses, typically over 14-day period. If previously vaccinated, only 2 shots are necessary. Initial dose promptly given after exposure, followed by additional doses on specified days. Wound care. Critical in all cases, carefully clean the wound with soap and water for at least 50 minutes. Apply antiseptic like povidone iodine or alcohol to affected area. Now, let's discuss the different levels of exposure and the recommended PEP measures. First, no exposure. Animal leads on unaffected skin. PEP measure, wound care. Second, mild exposure like nibbling, tiny scratches or cuts without bleeding. PEP measures, wound care and rabies vaccine. Last but not least, severe exposure, which is bites, scratches or contact with an animal's saliva on broken skin or mucous membranes, especially from bats. PEP measure, wound care, rabies vaccine, and HRIG. Conclusion, understanding the urgency of rabies treatment and the appropriate PEP measures is vital for preventing this potentially deadly infection. Thank you.
Moving on, I am going to explain the points on the preventative measures for rabies. First things first, avoid strays and wildlife. If you see animals on the street that you don't know, like raccoons or foxes, especially dogs or cats without owners, it is best to keep your distance from these animals because they might carry rabies. It is important for you and your pets to stay away from them to stay safe. Moreover, it is best to secure your property by making your home not too inviting for wild animals. Closing up holes in walls or attics and keeping trash cans closed tight can help keep those animals away. This makes it less likely for them to come near and reduce the risk of rabies. If someone might have been bitten by an animal with rabies, getting special shots quickly can stop rabies from making them sick. Acting fast is really important here to keep everyone safe. Post-exposure prophylaxis or PEP refers to a preventive treatment given to individuals who may have been exposed to a particular disease, such as rabies, after a potential infection has occurred. Vaccinating cats and dogs with special shots is also a great way to stop rabies from spreading. Since they are often the one that carry this virus, giving them these shots help to protect us from getting sick too. As a conclusion to this presentation, teaching people about rabies is crucial because it helps everyone to stay safe. When people understand what rabies is, how to avoid it, and what to do if there's a risk, they can protect themselves and their communities. Spotting the signs, acting quickly after exposure, and spreading this knowledge through schools, communities, and healthcare providers are the keys in preventing rabies from spreading. By educating everyone about rabies, we create a safer environment for everyone to live in. Thank you for listening. Let's work together to keep rabies away and make sure our friends and family stay safe and healthy.